this is the video competency for MA 180 using a peak flow. For this competency, we will start off like you do with most competencies. You'll go to the other room and you'll do a medical aseptic hand wash, and then you will gather your equipment. The equipment that you need for this competency is you will need your patient's chart, an encounter form, a black pen, a mouthpiece, and a peak flow meter. Okay, so the next thing that we're going to do then is identify our patient and explain the procedure. So I'm going to call my patient, Erin Woods. Hi Erin, how are you today?
I'm very good.
Good. I'm going to have you have a seat in the chair for me today, okay? Mm-hmm. All right, Erin, the first thing I need to do is ask you your birthday. What's your birthday, please?
April 10th, 2003.
Okay, so again, I'm going to verify this with what we have in the chart. All right, Erin, today the doctor has asked us to do a breathing test, okay? This test is called a peak flow, all right? Have you ever had one of those done before?
Not that I can remember, no.
Okay, all right, well, it's real easy, okay? What we're going to do is I'm going to take this mouthpiece and I'm going to put it on the peak flow meter like that, okay? These are single-use mouthpieces, so when this patient is done, we toss it in biohazard. And what I need you to do for this is I'm going to have you stand up, and I'm going to have you hold this meter, and you're going to wrap your lips around here, and you're just going to blast out as hard as you can, okay?
Is there anywhere I shouldn't put my fingers or my hands?
You're going to hold it right here. I just don't want you to put your fingers near this red thing so that because this is your breath is going to make this go up, okay? All right, so I'm going to have you hold this, and whenever you're ready, you can put your mouth on it before or after, it doesn't matter. But the important thing is that you just blow as hard as you can, okay?
Tight seal or regular?
Tight seal, okay. Okay?
Sorry, I just had to
That's
ask.
fine. Whenever you're ready, go ahead and take a big breath in and push. There you go. Very good. Stop. You don't have to keep blowing. You just push hard on
just
this one.
hard. Okay.
Yep. And so on here now, what I'm going to do as the medical assistant is, you did a good job, patient. Give my patient any coaching. And I'm going to write down what result that they had in her chart.
Is it normal to fog up like that?
Yep, that's
Okay.
fine. He had a 310, which is fine. All right, we're going to do this 3 times, Erin. All right, so I'm going to move the lever back down to 0. And I'm going to give this to Erin again. And whenever you're ready, put it in your mouth. And like I said, the important thing is a tight seal and to blow out really hard. You don't have to keep blowing. Push. There you go. Good. All right, nice. Good. A little better. 320 that time. And again, we need to do this 3 times. Remember to return that to 0. I'm going to give this to the patient. And whenever you're ready, big tight seal, make this your best one. And push hard. Very good. Nice job. Well done. 390 that time. Good job. Okay, Erin, you can go ahead and have a seat.
Okay.
I'm going to take the mouthpiece off and put it in biohazard and fill out my patient's encounter form. And the encounter form is going to be filled out like we do all the others. Today's date, my patient's name, my patient's date of birth, the 99212, and again, the physician usually fills this part out. My patient may have asthma, they may have bronchitis, so whatever my patient is complaining of today. And then on here I have peak flow down here, so I'm going to circle peak flow. I'm going to fill this out, give it to my patient, and then I'm also going to document. Okay, so if you notice on my documentation, a couple of things. Again, you always want to remember the patient's name and date of birth needs to be on every page. Every entry should start with date and time, and then what I did. In this case, date and time, peak flow performed, and then we have 3 values. Her first value was 310, second value was 320, third value was 390. Peak flow is always done in 3s, like most of respiratory testing. And then I don't need to put results in chart because right here are my results. And then I have it signed, first initial, last name, with my credentials. So documentation is very, very important. It should be done the same each time. All right, so I throw the mouthpiece away on biohazard. Erin, you did a great job. You're all done. Let me give you your encounter form and you can check out at the front desk. You're not dizzy or anything?
Nope.
Okay, you can go ahead and go. Thank you, Erin.
Thank you.
All right, now, again, I would clean up my room. Documentation is done. Make sure my room is disinfected if need be, and go do a medical aseptic hand wash. And that's all.